So, success of weight management is. So, according to the current guidelines of obesity management, weight loss comes after weight maintenance, because this is a common scenario that you might have experienced, that when patients come, they say that they are gaining weight. Every year they are putting in 1 pound, 2 pound, 3 pound. And if you look at the end of 5 years, they have gained like 25 pounds. So until and unless there's no weight maintenance, weight loss cannot be achieved. So weight maintenance is the key. So success of any weight management program is weight maintenance. So if you go to any commercial weight loss program, the way you can judge them if they are doing the right thing, if they offer you a good 6 months of weight maintenance package, either is Weight Watchers, is it Dr. Poon or Dr. B or whatever, Herbalife, Magic Life, Nutrisystem. If they have a good weight maintenance program that they do offer you as part of the weight loss, this is how you're going to judge that they are the good weight management programs, because the weight maintenance is the key. So talking about the what should be our success, and because this is a common thing that people wants to know when they come to us, the program, is how much I'm going to lose. Is weight loss seen on scale? Is it what our criteria is, that whatever is the number is this how we're going to judge the success? Because previously that's what we used to say, lose 5 pounds, lose 10 pounds and come back and see me. So the way I want you to think about this is that the weight on a scale, the number on a scale, and the fuel gauge, do you think they are the same? Because if you just are focusing on the number that, what, I have been doing it for 2 weeks and I have cut down on my calories and my weight number does not change. That's what I tell my patients, that our body, our weight scale is not equivalent to a fuel gauge in the car, that you put 1 liter, and if the car is really efficient, it may give you like 16 kilometers or 20 kilometers. If the worst cars give you 13 kilometer per liter. That's not how human body works. It's easy to say energy in and should be less than energy out and you lose weight. I mean, that makes sense on papers, but technically there are so many things happen in the background that does not give you what we really want. So I want you to change the focus from the weight numbers on the scale. The reason is that you have to understand that if you're playing around with calories, consider a body as a bucket of water. If you're playing around with calories and one day you have like 700 calories and the next day you take out like 400 calories out by really going on a marathon, and then the second day you put in like 2300 calories and the next day you did a deficit of 600. So when you're putting and taking out small and big amount, this body of yours, the bucket full of water, will always be wobbly, will always not come to equilibrium. So whenever you sit on a scale, it would not show what you're looking at. So weight scale, the number on the scale, it is not the true parameters to look for. Unfortunately, that's what I'm trying to explain here. So the first goal should not be on the numbers. Let's ask this question. Is weight a behavior or is it something else? Most of you are saying their weight is a behavior. Actually, weight is not a behavior. Weight is just a number on your scale. It is not a behavior at all. Weight itself, 140 pound, 150 pound, 160 pound, 200 pound, 315 pound, it's a number. It's a number. It's not a behavior at all. So the conclusion is, if weight is not a behavior and it is a number on a scale, so weight loss, the criteria of weight loss of 1 pound, 2 pound, 15 pound, it is not controlled by a behavior of low fat dieting, calorie restriction, exercise. Not at all. So that's why when we come to any weight loss program and we hope to lose 2 pounds, 5 pounds, 10 pounds, 15 pounds, and we're just focused on weight scale, we will have a very terrible journey. So remember the definition of obesity. They're not talking about BMIs anymore. What are they talking about? They're talking about improvement in health, mental, psychological, functional improvement. That's what it is. Now, why I am saying that, I would like to share this study with you guys. So this is a major, I would say, major breakthrough study that have actually made all the physicians think differently about weight. It was published in JAMA in 2018. And what it shows, so the kind of a graph that you see in front of you, it's called a waterfall chart. So what did the researchers did here is that they took two groups of people. You can see the first, the top group, the population were 215 in this group, and the later group was 221. So the first group, they put these people on a low-fat diet, okay? And the other group, they put them on a healthy low-carb diet. And what did they do after 12 months? They took their weight from each individual. So you can see this line, each line depicts the weight of an individual. So healthy low fat diet and healthy low carb diet, it's a behavior that you are doing, right? So what's going on here is that these patients change their behavior. They start eating either a low fat diet or a low carb diet. It in end of 12 months, when they individually did the weight of these patients on a scale, right? What did they find out? That one person here, just that line, have lost 30 kilogram. Like, so most of the individual did lost some weight. There were some group that they did not have any weight change. Even the behavior was changed. And there were some people who did gain up to 10 kilogram. So each individual here got that. And then look at the group here. So the behavior was changed in a low carb diet, right? And what did they find out? That there was some individual who did lost up to 27 kg, right? And look at each. So most of the individual did lost some weight. There are, few whose weight was maintained, but there was few who gained weight. What does it tell you? So even though you change your behavior, you restricted your calories, right? You went on a low fat and low carb diet, but still, when you looked at the number on the weight scale, this group on the right side, what did they find out on the numbers? It increased, right? So that's why the weight loss on a number, it's not a behavior. Okay, so that's what I'm trying to explain here. If we are focused on, even though you will say, I'm doing this, I'm doing that, my weight, my whatever I am, it's not changing on the weight scale. So I say, you know what, it's normal. That's what we have seen in the study. So then what? The next question is, of course, we'll get frustrated that, oh, my number is not changing. That's why number is not the criteria for success. It is not a good indicator for success at all. This is a very bad parameters that has been engraved from many, many years. And that's why we have so much unrealistic expectations from ourselves that we don't see the achievement that we have done. So then if we say that the weight number on a scale should not be the primary focus of or the success criteria, then what should be the success criteria, right? What's next? So this is something I want you to change the lens here, and it's going to take time. Honestly, it took me time. So what is the criteria? So this is what, as a health professional, that's what the criteria we are prompting. So if your numbers, so not the numbers on the scale, but there's certain numbers that we are very keen in changing, like your sugar numbers, your blood pressure numbers, your cholesterol numbers. So if they're going down, so A1C is your diabetic indicator, LDL is your cholesterol indicator. So if they go down, that is the success. If you're fitting into your old jeans and your old clothing, if you find your clothes are loose and you want to go and buy new clothes, that's what a success is. If you find your waist circumference has decreased and you are putting new smaller holes in your belt, this is the success. If your blood pressure is low, that is a success. If you're walking better, your shortness of breath is gone, your snoring is less, your reflux is better, you have less knee pain, back pain, you feel lighter, less bloater, good energy. And one of the good things that I find, one of my patients did say, he said, I'm able to carry my grandchild now without huffing and puffing, and I can do some stairs. Hey, this is the success, right? So I want everyone to think differently now. if you find any one of these things, and that's why you have seen me that I usually tell my patients to write down the things when they start, and then 3 months, 6 months, I make sure they go and revisit this and start cutting the things that they don't experience it.